60s, women are twice as likely to develop Alzheimer's disease over the course of the rest of their lives than they are to develop breast cancer.
Women carry the biggest burden when it comes to Alzheimer's disease. Not only are they more likely to be diagnosed, they're also more likely to take on full-time caregiving for spouses, parents, and other family members who develop the mind-destroying disease.
Here to explain how this disease impacts women's lives is Dr. Garrett Peel with the Prevley Clinic for Surgical Care. Doctor, welcome. Good to have you.
Good morning.
Good to have you. Well, let's talk about this. How common is Alzheimer's in women as opposed to men?
Well, Alzheimer's is getting more common among men and women. And when we look at the numbers, we see that about 5 to 6 million people have Alzheimer's in our country. Of those, 1 in 6 are women, as opposed to 1 in 11.
Do they have any idea why it's growing so much?
We feel that there's a genetic connection to the disease, and we don't know a lot about Alzheimer's. In fact, there is no cure. We can only give medication to essentially stop the progression, and that's why it's important to recognize some of these symptoms early, get treated early, so that we can give people a longer quality of life and slow that course down. What's also concerning is that if we look at who takes care of these people who have Alzheimer's, and over 70% are women. And so as our population grows and ages, we feel that it could be a real problem in taking care of our patients with Alzheimer's, because if more women are getting this disease, there won't be a lot of people to take really good care of them.
Yeah. Who's most at risk?
Women who are over the age of 65. So again, 1 in 6 women over the age of 65 will in their lifetime be diagnosed with Alzheimer's. Now, Alzheimer's is different than dementia. Alzheimer's is the most common form of dementia. And so just because you have dementia doesn't mean you have Alzheimer's disease.
Explain the difference between those two.
Well, it's actually a genetic disease, and we can actually look to identify the gene and also how it affects the brain. The brain itself starts to atrophy, so an MRI can actually diagnose that up front.
So if they're just for getting day-to-day tasks, that's more just the dementia.
It could be a start to the Alzheimer's disease itself, and so that's why it's important that you seek care from your primary care doctor. You will probably be sent to a neurologist for further treatment and or workup. And then also it's important that you maintain a very close relationship with your doctor so that they can monitor your
They'll
disease.
be able to tell if it's progressing, how it's progressing.
And another important thing to know is that as we look at other diseases like cancer and HIV and hypertension and stroke, all of those diseases are on the downcline for death. Alzheimer's is increasing twofold.
So if you know that you have a history then in your family of Alzheimer's, are there some things that we can do to reduce our risks?
There's really no way to reduce risk other than catching it early. There's a lot of patients who are in denial. You know, we all know older folks that cover their forgetfulness. The important thing as loved ones, let's try to recognize those risk factors early. Let's try to look at the early warning signs early so that we can get those patients to the doctor quicker.
Yeah, I know the research is ongoing and will be. What's some of the future focus on?
The future focus is on 2 things. Number 1, working to identify more genes that can cause Alzheimer's, and 2, working to stop the actual progression of deterioration in the brain with medication. We're almost there with the Aricept drugs and some others to slow the progression. However, it would be great to stop that gene in its tracks as early as possible.
Now, I know my husband's grandmother had Alzheimer's, and it becomes such a big burden for the family.
It's
really taking care of them,
disease,
and they're really the ones that suffer most. Should families seek some outside help more, or because you see a lot of these families taking it on themselves?
You know, it is one of the most debilitating diseases that we have, because Alzheimer's not only impacts the cognitive ability of the patient, but also the social, emotional, and up to the hygiene. You know, these patients need to be diapered, etc. So it really becomes a huge burden. The Alzheimer's Association is a wonderful resource. You can go to their website or call them. In addition, your doctor can provide you some of the resources as well, whether it be through home health options or even there are several Alzheimer's facilities here in Beaumont that are actually live-in facilities that provide excellent care for patients with Alzheimer's disease.
As always, and with anything, don't ignore the warning signs.
Early acceptance is the best.
Most definitely.
Perfect. Thank you
Thanks,
so much,
Dr. Peel.
Doctor.
Great to have
a wonderful day.
You as well.